Ni hao, and good morning to all of you. A special thanks to the organizers. It's truly a privilege to be in Shanghai, my first visit here. I will be discussing postgraduate training, some people would call it graduate medical education, from the perspective of what the ACGME's principles are in designing these programs. Dr. Nora emphasized how important it is, at least in our country, that peers set the standards. We view that as a tremendous privilege as well as a tremendous responsibility. To re-emphasize her point, accreditation does not deal with the individual. That's certification. Accreditation examines how solid an educational system is. I would emphasize, however, that though I'm talking about graduate medical education, we depend on our educators in medical schools to make sure that the education coming into our area is solid. Let's define postgraduate education. This is the medical education that occurs after medical school. We all know how a physician who just graduates from medical school really isn't ready to take care of patients quite yet. That's our role in postgraduate education, to make that person grow into someone who is capable of independent practice. Our goal at ACGME is to make sure that the educational programs assure that every person in one of these programs reaches that achievable goal of capable of independent practice. We want to mass produce quality physicians. My current role with ACGME reaches out to different countries as well. It's been fascinating to see how much there is a continuity of the need for graduate medical education standards at the institutional level, within programs, both shared among all programs as well as specialty. It's also interesting to see that the habits that are learned in training internationally carry throughout the individual's professional career. Finally, I would just add that so much of a system of education that we seem to like in the United States seems to be exportable to different countries. Let's talk about the learning environment, the institution's responsibilities. There must be a commitment to education. A program with the best teachers in the world cannot do it unless they are within an institution that supports education. And support means money for the teachers, protected time for education to occur, an environment where educators can speak among themselves so that silos don't persist, and an appeals process so that if a person feels in an educational environment they are not being protected, they have some mechanism to reach out to review things. There must also in this institution be a commitment to patient safety, and the resident must be involved in this patient safety endeavor. And finally, the institution is responsible for supporting the residents. They are the residents' advocate. They provide contracts, and they provide the resources and educational facilities that are necessary for a solid education. Let's look then at the shared program standards. Regardless of the specialty, certain things are essential. We believe that it's important that there be one person responsible for an individual throughout that individual's resident training. We call that person a program director. We also feel that there must be a dedicated faculty with a specific ratio so that there are enough faculty to care for the residents. And these faculty must contribute to the body of knowledge, and we call that scholarly activity. The faculty must also be readily available for supervision. And I don't just mean from 8 till 10 in the morning. I mean at 2 a.m. when the crisis occurs in the emergency room. All programs must evaluate their residents, and these evaluations must be a summative evaluation, how you are doing, as well as formative evaluations, what you need to do better moving forward. These evaluations are important not only from a general perception of you're doing a good job, but rather looking at specific competency areas. Patient care, we all know what that means. Cognitive knowledge is the resident reading and learning as he or she progresses. Practice-based learning and improvement. When there is another patient that comes along with a similar disease process, has the resident learned from previous care of similar patients? And what's different about the new patient? Communication skills. How does the resident talk to the patient, to the family, to colleagues, to team members of the healthcare system? Terribly important. Professionalism. Above all, this competency must be evaluated. Does the resident truly care for the patient's needs? And then systems-based practice. We heard about the many different systems in different countries, and it's really important that as we train our individuals, that we train them to the system in which they are to practice. We tend to think of postgraduate education too much about specialty-specific standards. What does it take to become a urologist, a pediatrician, a general surgeon? Certainly, those are important, and a standardization of curriculum, the necessary clinical experience, the elements of supervision, as well as graduated responsibility are terribly important. And milestones as we move toward competency-based education are becoming increasingly important in the educational system. And finally, programs have specific evaluative issues that they will be addressing. To talk a bit about this process for setting standards, we use review committees. These are peer individuals that are volunteers with term limits. The ACGME makes sure that review committees among the various specialties treat things rather similarly. There can't just be one way of doing things. And there is an overriding board of directors that looks at how the review committees set standards. Clearly, as we all move forward in our different countries, cultural and societal considerations are very, very important. The demographics, we've heard the particular aging demographics of this region. And then there are norms for scope of practice. In some communities, family medicine physicians deliver babies, in others they don't. There certainly are different ways of talking with patients who are dying, and the issues of autonomy and surrogacy must be country-specific as well. Training for patients training of physicians must be kept with an eye toward not only today's current patients, but also tomorrow's patients. And so that's why it is much more than just training a specific skill. It's all of the underpinning of education that's terribly important. Always, we need to train for soft issues that are really firmly important, such as patient safety and quality improvement, cost containment, and an ability to change as new technologies are created. One of the barriers to postgraduate educational change are the people who have been accustomed to doing it a certain way. If it's good enough for me, it's good enough for them. Well, we all know that education and technologies have changed that, and we need to have a systematized approach toward education. We do know that training is important. It affects the cost that a doctor will deliver decades down the road. It affects their ability to make clinical practice judgments, and it affects their patient outcomes. And I would suggest that you look at these references at a future time. When we validate a program, it's really essential to look at data. And so there are many different elements of data that the review committee will look at. I would emphasize also the importance of a site visit by an independent evaluator, and the fact that accreditors should not have conflicts of interest. They cannot evaluate and accredit programs that they might know themselves. As the decisions come forward, there needs to be an accreditation length, which varies depending on the strength of the program. And the need to be a supportive decision rather than a punitive decision. To leave you with a few summary comments, the essential elements for postgraduate education include standard setting, institutional support, validation of compliance with the rules, independent peer review. And these components are adaptable to so many different settings. If China can build a great wall, perhaps China's current dilemma is to build a great graduate education system. Thank you.
Thank you.